Welcome, everyone. We'll just give others like a minute or two to join. Let's see. While you're waiting, if you haven't already completed the pre-evaluation, please go ahead and do that now. The link is there on the slide. Okay, and then Veronica and Alexis, the same way you post, you can help keep an eye on the waiting room. That'd be awesome.
I'm sorry,
Oh,
Mary,
let's see, I
say
need
that
to
again,
turn.
please.
Yep, okay. Sorry, I just was wondering if you could help me keep an eye on the waiting room.
Absolutely. And I can let them in, right?
Yeah, you should be able to now.
I have access to let them in. Okay, great.
Yep. And
Thank you.
can everyone hear me okay? I'm got kind of a different setup as I'm in a hotel for a conference, so I hope this is working for everyone.
Yes,
Okay.
it sounds good, Mary.
Thank you. Okay, well, it's a couple minutes past. I think we might as well get started. Just as another reminder to complete the pre-eval if you haven't yet. And we'll move along. Okay, today is part 2 of the grant writing workshop. Hopefully you were able to participate in our part 1 last week. Some reminders before we get started. This training builds upon the Cancer Prevention and Control Research Network's curriculum called Putting Public Health Evidence in Action. And a reminder that this training is centered around a funding opportunity that we have through the UNC Lineberger Office of Community Outreach and Engagement. We're offering up to $20,000 to plan and implement evidence-based interventions specifically for cancer screening. The letters of intent are due at the end of the month on the 31st, and the proposals are due on the 18th. The RFA is now published. You should have, if you participated in the first part of this training, you should have gotten an email from Veronica. But we also can put a link in the chat to where you can find the RFA. If Veronica or Alexis could help me do that, that would be great. Also, if you are able to share a little bit about yourself in the chat, it's fun for us to get to know who's all on the call. So feel free to include your name, your title and organization, and your cancer focus in 3 words or less. Okay, and then we'll just kind of keep an eye on introductions as they come through, but I'll keep us moving along. So kind of as a reminder, this is our training overview. Part 1, last week, we talked about grant writing tips and different proposal sections like the project overview, the background and significance, engaging partners, and we started to talk a bit about how you might select your evidence-based interventions, and then how to put all that information together to develop our SMART objectives. So we've completed that part. A lot of what we talk about today will build on part 1. Now today in part 2, we're going to talk more about how to actually write your project plan and timeline, as well as your evaluation plan, a little bit about planning for sustainment, and then we'll conclude with a little bit about the resources and the budget part of the proposal. Another reminder that new this year, we're offering some post-award training to those that are funded. Those in the Tier 1 category of the grant will be encouraged to apply or to attend a training that goes more in depth on finding and selecting evidence-based interventions, as well as adapting evidence-based interventions. And for Tier 2, implementing evidence-based interventions, as well as evaluating and sustaining will be the main focus. you're also welcome to attend any of the trainings, no matter your tier, but we would recommend that you attend at least the ones listed here. I see a question asking if the recording of part 1 is available. I did record it. It's not posted anywhere yet. We'll have to look into doing that and we can send that out to everyone. Okay. So let's go ahead and dive into the project plan and timeline. So the RFA specifically asks you to outline the activities that you will accomplish to achieve your objectives and include information on who will do what and when. So why is a project plan and successful implementation important? You can have the most effective intervention in the world, but if you implement it poorly without proper planning, you're likely to miss out on the core components of the intervention or the activities that make it the most effective, leading to poorer outcomes. So if your intervention that is known to be effective is also implemented as intended, you're much more likely to achieve the positive outcomes that you're hoping for. So this implementation plan or project plan we're talking about today isn't just important for your proposal, it's also important for the success of your project. So here are some 5 steps towards writing your project plan that we'll cover a bit more in depth today. The first step is what we've already started talking about in the part 1 of this training. You want to make sure that you identify your needs, your target population, and establish your goals. And that information is going to carry forward into your project plan. You also want to make sure to assess your organization's readiness to implement the proposed project, because what you learn in that readiness assessment can help inform the next step, which is activity plan. The activities related to your program implementation, but based on your readiness assessment, you may have a few more pre-implementation activities that you'll want to include. Then in the 4th step, you'll simply explain who will implement the work and what their roles are. And in the last step, you'll include a timeline to show when the activities will happen. And as always, throughout this whole process, you want to involve your whole team and your partners to make sure that they're on the same page and that their voice is heard as well. So let's go step by step. First, assessing your needs and establishing your goals. Since we've already talked about this in part 1, once you get to this step, you should already have your assessment completed. Not necessarily you right now, but in general, as we're going through the process, so you'll want to review the results of your needs assessment and remind yourself of your goals and objectives that you established. So here's an example. If we were deciding to implement a program called FluFit, which is a program that combines FIT kits or fecal immunochemical test kits for colorectal cancer screening with getting a flu vaccine. We don't need to go in depth into what the intervention is, but we'll just kind of use it for an example for today. So if we were implementing that intervention, here are some goals and objectives that we might include. So just as a reminder, to kind of list out your goals and objectives when you're starting to write your plan. Also, as another reminder, these are objectives from a sample grant that I showed in part 1. This was an applicant that was funded for one of our community pilot grants in the past, and these were the objectives that they included. I'm not going to go over each one, but I just wanted to share them with you again as an example when you're sharing yours.
Excuse me,
Oh,
Mary.
so
I apologize
now
for
yeah.
Mary. I apologize
Oh,
for
no,
interrupting.
go ahead.
I think you're going in and out. I'm experiencing that. Are other folks on the call experiencing it? And if
Um,
so, I wonder if maybe would it help if you turned, yeah, okay, I'm seeing it. If you turned your video off and maybe just audio, if that might help. I don't know, but you are
I can
every now
try
and
that.
then,
I
it's
can
not
try that.
consistent. It's not
Okay.
consistent, but we
Well,
never know when
Veronica,
it's going to pop up.
what I think I'm gonna do is try calling into the phone audio. I
Okay,
see I have full LTE on my phone, so that might help.
okay,
Otherwise I'm using hotel Wi-Fi, so I
okay,
might have limitations here. Let me try that.
okay, okay.
Welcome to Zoom. Enter your meeting ID. Enter your participant ID followed by pound.
Thank you for your patience, everyone, and it's good to see folks on the call. Just
You
as
are
an
in the meeting.
FYI, I've had a couple of people reach out to me with questions. I just wanted to let you know, please feel free to continue to do that as you're looking over the applications. The application template, and you have questions about anything that we've discussed so far, or questions about I don't know, things like the budget. I've had a couple of budget questions, so please feel free. As one, you might be even just in the midst of considering whether you're going to apply, or if you know you're going to apply and you just have questions completing, about anything completing the application. So feel free to reach out. Okay, Mary.
Thank you, Veronica. Yeah, so thanks for your patience. I'm on my phone now. Does that audio seem acceptable? Oh, you're muted,
Yes,
Veronica.
yes, that sounds great. And you were freezing sometimes, but you sound much clearer even with what you're doing now. So this sounds good. Thank you.
Okay, good. That should work better. Thank you for letting me know about that. Okay, so the second step to developing our project plan is to take a little bit to assess our readiness for implementation. There are lots of different readiness checklists out there. If you are interested, we can send more resources about this. But simply, there are some questions that you might ask yourself, such as, do you have leadership support for the intervention? Have you identified staff to deliver the intervention? Do you have plans for educating and supporting staff? What space, equipment, or materials are needed, and do you have those? Or do you have a plan for recruiting patients if that's one of the activities in your intervention? So this is kind of thinking about, like, what are you going to need to implement the intervention? And is there any preparation that you're going to need to take before you actually start implementation? Because those are going to be activities that you'll want to include in your plan, especially for those in Tier 1 that are in the planning phase. A lot of your activities are probably going to be more related to addressing your readiness for implementation and developing your plan and identifying your intervention, rather than specifically about implementing. Okay, so then kind of going back to our case study, when completing the readiness checklist or answering those questions, you may find gaps in your readiness for implementation. And this will show you what you need to focus on improving before you start implementing, as I was saying. So in this case, for our FluFit case study, let's say we found the following gaps in readiness. They had a lack of leadership support, they had inexperienced staff, and they currently did not have a plan for recruiting patients. So we can tell right away that those are maybe areas that they'll want to work on, and places where they could create some activities to go in their project plan. Okay, so then that would bring us to our third step, which is when we would detail the major activities. So you want to identify activities to include in your plan, and you do that by doing what we just talked about: reviewing your goals and objectives, reviewing the information about the EBI, because that's where you'll identify the steps for the actual intervention, and then also reviewing your readiness for implementation. So here's an example of a project plan for FluFit. And notice how I've included a pre-implementation and an implementation section. The pre-implementation is a good spot to put those activities that will improve your readiness for implementation. So for this case study, they decided they needed to create a system to flag patients due for screening in the EHR. They also needed to purchase the fit kits, and they needed to make sure they had their pilot tests of fit instruction materials ready to go. And they also created and piloted a log for tracking the fit kit distribution and return. And they also needed to train their staff, as that was inexperienced staff was one of the things they found on their readiness assessment. So then when it came to implementation, there would obviously be a lot more steps, but I just included one activity for an example, that is to send the MyChart message to the eligible patients as the first step. Okay, so then moving on to the next step, this one's a little more straightforward. You want to also identify who is going to do those activities. And it's really helpful to be as specific as you can be with this, including names as well as roles when you're adding these to your plan. So going back to our FluFit project plan, we can now add another column for the person responsible. And as I said before, in your plan, you'll want to be a little more specific than this and even include the names if it's applicable. So here I've just, for example, for the create system to flag patients due for screening in EHR, it would be the IT manager that was going to do that. And you can see I have different roles for the rest of the activities listed here. Then the next component of the project plan is the timeline. So when thinking about your timeline, you want to make sure that every major activity in your proposal also appears in your timeline. And these could be kind of condensed into one line of your timeline. You don't necessarily need them line by line, but the major activities and the overarching categories of activities should be in your timeline. So for example, if you say that you, in your proposal, in your project plan, if you say we will conduct outreach to patients in local clinics, your timeline might say from March to April, you'll do patient outreach through flyers and phone calls. So that's a good way to start creating your timeline if you're stuck, is by looking at your activities and adding a time frame to each of them. You also want to make sure that you're realistic about the time. And a helpful tip is to break your project into manageable phases, like planning, implementation, and then evaluation. You don't want to cram all of your activities, for example, into 1 month. You might need to give some breathing room and show a logical flow. You also want to use clear timeframes and choose a format that's easy to follow. So you might decide to list timeframes by month or by quarter or specific dates. And use a consistent method throughout the whole timeline. And then you want to make sure that the timeline lines up also with your budget. For example, if you have a staff member on for 6 months, don't list 9 months of activities. And then you want to make sure to keep it as simple as you can and as visual as you can. So you might not have every little detail listed, but the larger concepts in the larger activity categories listed. So one simple way to create a timeline is just by adding a due date column for each activity in your project plan. And so as you can see here, we've done it for the FluFit project plan where we've just included a due date. And it's just a monthly time frame in this case. So here is an example of a project plan from that same successfully funded application that I was showing you previously. They included their timeline column in their project plan table. Which you can see right here. And they've also included an ongoing time frame for each activity. So they said that this will start August 2023 and then occur monthly. So including the frequency in your timeline can also be helpful. Another common type of timeline is called a Gantt chart. This is slightly more complicated and you don't necessarily need to present your timeline like this in your proposal. But a Gantt chart can be a helpful visual way to show when each activity in your project will take place, how long it will last, and it can also show how your activities might overlap. And you can quickly see if you're working on the same activity at the same time. So it also helps funders quickly understand your project flow and feasibility. But this is also the type of timeline that us researchers often use when we're submitting our large research grants. So I thought it'd be kind of nice to show you another option. Like I said, you don't have to create your timeline in this way. If you are interested in it, however, we have some tips for writing a Gantt chart. You'll want to list your major activities down the side, like outreach, training, data collection. You'll often use a monthly timeline across the top. The timeline can be different too. If it's a shorter project, you might even have each day across the top. And then you want to block time for each activity using bars or shading to show the duration. And you might also include milestones like start or end dates, key deliverable dates, or reporting deadlines. Sometimes I might use a little symbol. Like if I go back to this table, you could put a little symbol in the box and make a key that says that that means a certain activity will happen at that time frame, or at that one time point. And then you want to make sure that your chart, of course, aligns with your program plan and budget, and keep it clear and simple. You want to avoid crowding too many tasks and details. So you might have to kind of lump things together into larger categories so that the timeline can stay nice and neat. Okay, so now we can move on to the evaluation plan. So we just talked about our project plan. You're going to want to include a little bit about your evaluation plan in the proposal as well. And why do we conduct evaluations? Why is this important? Well, evaluations are a way to track your progress and inform your partners about your progress. Evaluation data can be used to improve your project and also help you see whether or not you're making the desired impact. And this is really helpful to share with funders as well. You know, most funders are more likely to continue funding a group if they can see that they're making progress. So what is an evaluation plan? It's just simply like your roadmap for how you'll measure your project success. And it describes information like what you'll track, how you'll track it, and when. And it includes what your outcomes will be, your indicators, or how you'll measure your success, as well as the way that you'll collect the data. So we'll talk a little bit more about how to write one now. So we've created like a simple 4-step process for you to write your plan. The first step is to outline what you already know. So going back again to our activities and goals that we already talked about outlining for our project plan. And then you'll use that information to write your evaluation questions. And so those are what you want to learn from the evaluation. And then in step 3, we decide what to measure to answer those questions. And in step 4, you'll want to think about what evidence you'll need to measure to answer those questions. And so in thinking about the evaluation, you might ask yourself, did you do the activity, and did you achieve the outcome that you wanted to achieve? So let's go through those steps now. The first step is to list your activities and goals. These items highlight what you set out to do when implementing your program and are a good place to start when thinking about how you'll evaluate your program on its implementation and effectiveness. So here we have a list of a few activities from the implementation plan for the Flu-Fit program, starting with eligible patients and moving through the process to communicating results to patients. So these Flu-Fit activities are leading us towards our goal to increase colorectal cancer screening rates through high quality implementation of the evidence-based Flu-Fit program. So next, it's time to actually write our evaluation questions, and we can write evaluation questions by activity. It's at least a helpful way to start. You will also want to be careful not to have too many evaluation questions, so some activities might be lumped into one larger evaluation question. But when thinking about what questions, you might ask yourself, is the activity being implemented as planned? Is the intervention feasible and acceptable? Are you reaching patients, particularly those at greatest risk? And are you reaching other audiences, providers or policymakers? And when it comes to evaluating how you have impacted the outcomes, you might ask, do behavior, knowledge, or attitudes change? Do cancer screening rates improve? Do cancer-related mortality decrease? And so on. So these questions will vary depending on your intervention activities and goals. So keeping that in mind, let's see here, we've got 3 activities for our Flu-Fit program: distribute kits to patients, collect return kits from patients, and communicate results. So some simple evaluation questions that we might add for each of these. For distribute kits to patients, you might ask how many patients received kits. For collecting return kits from patients, you might ask how many distributed fit kits were returned. And when it comes to the communicating results activity, how many patients were notified of their results? So in the third step of writing your evaluation plan, you want to start thinking about what you will measure to answer each of those questions that we wrote in step 2. So here again, I have some examples in the table, starting now with those evaluation questions and including our performance measures. So for how many patients received fit kits, we want to measure that by calculating the number of patients who received the kits over the number of eligible patients. So then when we're asking ourselves how many distributed fit kits were returned, we'll measure by calculating the number of kits returned over the number distributed. And then how many patients were notified of the results? That's a simple count, the number of patients who receive results and follow-up. So thinking about this a little more, let's practice with this example here. So how would you answer this question? And what data would you collect and measure for this question? What barriers are patients encountering to completing and returning a fit kit? Any ideas? You could put them in the chat or come off mute. So if this was your evaluation question, what data would you collect to measure, to answer and measure this question? Okay, Melissa is saying unmet needs survey or social determinants of health prepared data collection. Okay, I'm not as familiar with that tool, but that sounds like it could be a great option. Any other ideas? Okay, yeah, well, Melissa really nailed it. That's kind of what I said too, that you might just measure patients' perceived barriers simply by asking them in a survey or even in an interview. And this is a good example that not every measure for your evaluation will be a number, like we were, you know, those fit return rates and screening rates, those are all quantitative numbers. You might have qualitative answers to your evaluation questions too that come from surveys or interviews. Okay, let's keep practicing this. This time I want you to think a little bit about the project that you're planning to propose if you're hoping to apply for this funding opportunity. What are some evaluation questions that you might include in your proposal? And how will you track if you did that activity and achieved the outcome that you were hoping for? And remember to think about your goals and your activities when thinking about this. And again, if you have any to share, I would love to see it in the chat, or if you want to come off mute and share with us. But go ahead and take a minute or so to think about it too. Any ideas? I know it might be early in the process for you to have some of these thought out already. Okay, well, if any of you think of one as we go, oh, I've got one. I went too quickly. So dot form tracking of outreach and project education to targeted communities. Okay, great. Anyone else have one to share? Okay, well, we can go ahead and move on to step 4. So now that we have talked about the questions that we'll need to answer and how we'll measure them, we want to think about how we can collect data related to those measures. So first, you could try looking for existing data like we did in the assessment. You could also talk to partners to identify data that's already being collected. For example, through the EHR or existing tracking logs. In the first module or the first session, we talked about different sources of existing data. Those might also be useful for long-term evaluations, but they're sometimes challenging in the short term because they're reported only annually or may not be that current. So if you don't have existing data, you'll want to start to look for ways that you can collect data on your own. So you might need to create surveys or tracking logs and use those as part of your evaluation. And then lastly, you want to think about who will collect the data and when and how often the data will be collected. So here's our table again, and this time I've added another column to include the data source or where you'll get your data from. So thinking through this is helpful so that you can identify if the data that you'll need to answer your question already exists or if you'll need to determine a new way to collect it. So for our how many patients received fit kits, we'll collect that data from our fit tracking log. And then how many distributed fit kits were returned, we can track that from our fit tracking log, but possibly the EHR as well, if that's a data point in the EHR. And then how many patients were notified of their results. We could track that through the EHR as well as reports from the GI clinic. So next, you want to make sure that you include the frequency in which the data will be collected, such as monthly or pre and post program. So it's helpful to include also who will be responsible for collecting the data. And on your plan, you'll want to be even more detailed and include the names and roles of the person responsible. And you can make your own table like this using our evaluation plan template, which I've also sent out to you all by email. So for that first evaluation question, how many patients received fit kits? We've got that they'll collect that data monthly and that the staff nurse is the one who's responsible for collecting it. Okay, so here's another example from the sample grant that I've been showing you. In this case, they've incorporated their evaluation plan within their project plan, which can be a helpful way to do it. So here you can see they have their evaluation and performance measure right underneath their objective. And I want to point out too, this is just part of their plan for objective 1. So they have a section like this for each objective in their application. So under the objective, they have their performance plan for how they will measure that they've successfully achieved this objective. And then they also have the data source and the person responsible as separate columns in their plan. So they've incorporated their timeline and their evaluation plan and project plan all into one table. So you can get kind of creative how you do it. Otherwise, I do have templates for separate implementation project plans and evaluation plans that I sent out to you as well. Okay, now we're going to talk a little bit about the sustainment plan. As far as I know, the RFA doesn't specifically require that you submit a sustainment plan, but I want to talk a little bit about this because it's important to think about sustainability during your early planning stages. And if you're able to share a little bit in your RFA about how you plan to sustain the work beyond the grant period, that's certainly a bonus. So I thought we could talk about it a little bit today. So here's our definition of sustainability. After a defined period, the program or intervention or strategy continues to be delivered or individual behavior change is maintained. And so the program and individual behavior change may evolve or adapt while continuing to produce benefits for individual systems. So we like to use this comprehensive definition because it gets at the point that the program may change over time in order to be sustained. So sustainment does not necessarily mean the continuation of the program in the exact way that you originally implemented it. Sometimes if we are evaluating our program and are learning that in order to keep it sustained, we need to make some changes. So just wanted to kind of throw that out there too. So why is sustainability important in the first place? It's important to help us realize the full potential health benefits of the EBI, which sometimes aren't experienced until years later after implementation, sustained implementation. It's important to help us maintain strong and trusting relationships with our partners. If we are frequently starting a new intervention, a new study, a new project, and not completing it, we might really frustrate those who are partnering with us. So it can be an important, thinking about how it'll be sustained can be an important way to build trust among those who you're working with. It also helps to promote health equity, as evidence-based interventions are more commonly discontinued in settings serving populations experiencing inequities. So it's something important to think about. And in developing this training, we learned that only about half of all EBIs are sustained. And I don't say that to make you feel discouraged, but just to show that it is difficult and to highlight the importance of thinking about how we might sustain our projects from the beginning so that we can be in the statistics of those EBIs that are sustained. Okay, so there are several different frameworks that we can use to assess our EBI's potential for sustainment, and these frameworks can help us think about activities that we might add to our sustainment plan. One of those frameworks is the Integrated Sustainability Framework, and this shows how multi-level factors can influence our program sustainability. These factors in the framework include policy and environmental factors, organizational context, processes, implementer and population characteristics, as well as project characteristics. And so for each of these factors, there are a few questions that you can answer to identify any gaps in your EBI's potential for sustainment. And then once you identify those gaps, you can turn them into strategies or activities to add to your plan. There's also I'm going to go over some of those questions now, and I've also sent out a handout that's like a worksheet where you can work with your team to answer some of those questions. So going kind of factor by factor, thinking about policy and environmental factors, some questions you might ask yourself and your team is what's the broader funding environment like, and are there external funds that could help sustain the project? You're obviously thinking about that already while you're here, listening about this funding opportunity. Are there external partnerships that can bring resources, support, and commitment to sustain the project is another one to think about. And then moving into the organizational context, are there program champions who can influence sustained delivery of the project? Within the organization, is there time, resources, space to support the project, and how ready is the organization? You might be noticing some of these are things that we've already talked about for creating our project plan. So there's a lot of overlap in all of these pieces, in the project plan, evaluation plan, and the sustainment plan. And so you can also maybe see why it's important to think about sustainability at the beginning, because some of these are also supporting how ready you are now to implement the intervention. When it comes to the process, are there processes to support the recruitment and retention of staff involved with project delivery? And are there processes to track data and project impact or delivery? And so again, these can fit in the readiness assessment too. So I think one takeaway of this kind of how similar these two pieces are is that for the sustainment piece, this is probably something you're going to want to review as you go. So you want to think about it on the onset, but then maybe halfway through your implementation and at the end of your implementation, you might ask these questions again with the mind for like continuing the implementation, or is there anything that we need to change to make sure we still have these processes in place and those types of things. Then moving to implementer and population characteristics. Do the implementers have the confidence to deliver the project over time? What experiences of the population served might impede sustainability? Maybe stigma, mistrust, literacy, poverty, or discrimination. You also, when thinking about project characteristics, might ask, how well does the project fit with your context, and how adaptable is the project? Does the project continue to address a priority or a need in your community? I also want to mention, but we'll cover a lot more about program sustainability in the post-award training too. But if you have any questions about this piece, feel free to reach out as well. Because now we're going to move on to the last piece of today's training and talk about the resources and budget part of the proposal. So the RFA asks that you describe your organization and its capacity to complete the project plan. So that includes the resources and partnerships that you have. And then it also asks you to submit a simple budget that describes the cost for completing each activity, and it wants you to show a connection between the funds that you're requesting and the activities that you plan to carry out. So some tips when thinking about writing a budget for grant proposals. You want to try your best to match your budget to your work plan and fund what you plan to do. I've mentioned that quite a bit already. You also want to be realistic and use reasonable, well-researched cost estimates. So like when we're writing big grant proposals for our research activities, we often will, look up what will it cost to travel to this conference, or what will it cost to transcribe the interviews, and actually find, some quotes to help us create our budget. You don't need to get formal quotes necessarily from the company, but doing a little research can help come up with numbers. Because you want the budget for the grant proposal, but you also want the budget to complete the work. And so if you can make those estimates as close to real life as possible, it'll only help you once you're funded. You want to include all key costs, so materials, travel, incentives, whatever it is that you'll need. And if you can justify them in a narrative, it's helpful for most proposals. I don't think we're requesting a specific budget narrative in this case, but know that it's helpful to justify your costs if you can. And then you also want to make sure you're looking into the limits and allowable expenses for each proposal that you're applying for, making sure to follow the funder's instructions. So in our case, we do have a list on the RFA of allowed expenses and expenses that are not allowed. As you can see, you're allowed to include project supplies, copying and printing, meetings, publicity, incentives, travel-related costs, contracts, training and TA, or expenses for attending, especially the training and TA that we're offering, and programmatic activities. And then we have a list of expenses that are not allowed, like food or entertainment, equipment, or other similar types of, other like similar types of capital expenditures, software or computers, furniture, memberships, payments to research organizations or individuals, individual salary support, healthcare services, or medical reimbursements, as well as any indirect costs. If you have questions about those, because I know it can be kind of tricky sometimes to know what expense counts as what and if it's allowed or not, feel free to reach out to us, especially Veronica, and we can help you think through whether it's allowed, and if it's not allowed, how we might kind of tweak it to an expense that would be more allowed in this case. So feel free to reach out if you have questions about that. And then next, I just have a sample budget for a Tier 1 application to show you. This is also on the RFA, so you might have already looked at this. But it's very simple. We have our activity expenses listed here and the amount that's budgeted for them. So I'll let you, take a look at that on your time. If you're applying for the larger Tier 1 application, we have another example here that includes that whole $20,000 amount. Again, you can take a look at this on your own time, and it can help you think of ideas to include in yours. And then I just wanted to include with a refresher on those general grant writing tips that I included in part 1. So we talked about how you want to know your funder. You all are already taking the first step in knowing your funder by attending these trainings and reading the RFA and learning about what we're expecting. But keep that in mind that you want to do that for all proposals you're applying for. You also want to follow the instructions exactly. And some proposals are very specific and want you to follow formatting and page limits. and all kinds of things. So make sure you're really reading the instructions. You want to write clearly and briefly define any medical or technical terms. It's helpful too to avoid abbreviations or make sure that you at least spell the abbreviation out the first time. And then when it comes to the writing style, it's helpful to use strong, active voice. So instead of saying we will partner with local churches, instead of saying screening events may be hosted, it's stronger to say we will partner with local churches to host screening events. So you can clearly see who is doing the action. And then, of course, this should go out without saying. You'll want to proofread your application, but it can be really helpful too to request a review from peers, especially someone who wasn't a part of the writing process. They might be able to see something that you wouldn't have normally been able to see when it comes to making edits or making sure that it's there's a lot of clarity in what you wrote. And then other tips, it's helpful to start early and break the writing process into pieces. And, you know, we talked about writing timelines for your grant proposal. You can also write a timeline for your writing process to help keep you on track. Okay, so here we are at the end of part 1. We talked about the project plan and timeline, evaluation plan, and a little bit about what to think about in terms of sustainment, as well as how to write the section on resources and budget. So good job. We've completed parts 1 and 2 of our training. Another reminder for the funding opportunity that this is based on today, the letters of intent are due at the end of July. Also, if you have questions about the proposal, especially, feel free to contact Veronica Carlisle. And last but not least, I've got the post-evaluation link here. We'll also send it out to you as an email either today or tomorrow. But go ahead and take some time to complete that. And that's all I have for today. So we do have a bit of time. I'm happy to stay on if anyone has any questions about anything. Yeah, okay, good question, Marilee. I will send out in my last email that I said I'll go out either today or tomorrow. I can send out all the materials from part 1 and 2. And then I will send out the evaluation link again as well. And we'll look into getting the recordings posted on YouTube so that we can share them to you. But that might take a little bit so we can, you know, edit out some of our front-facing material. But thank you all. Feel free to drop off if you're finished. Okay, no questions. Thank you.
I have a question
Uh-huh.
for you and Veronica. So I'm still in the thinking about stage, but for the audience, since our company is a broad quality improvement organization, but for the target audience,